Hello, I'm Dr. Kimberly Cress, Medical Director of the TMS Serenity Center located in Sugar Land, Texas. This video presentation will be in two parts. The first to discuss our TMS clinical success, and the second part to share a patient story of success. I'm a graduate of the University of Texas Health Science Center in San Antonio, Texas. I completed my psychiatric residency at Baylor College of Medicine. I then served on staff at the Mood Disorder Center at Baylor. I've been fortunate to participate in multiple clinical trials and co-author of several journal articles. I've been a resident of Sugar Land, Texas for 17 years and privileged to serve our community's psychiatric care. The information I am sharing today about our TMS therapy clinical success is a summary of our poster presentation at the American Psychiatric Association Convention in San Francisco, California. TMS therapy was FDA-cleared in 2008. I founded the TMS Serenity Center in April of 2010. At this time, we are the largest provider of TMS therapy in Texas. This information reviews, in a retrospective study, our first 64 of our patients from our start in April of 2010 through April of 2013. All patients were diagnosed with major depressive disorder and, interestingly, had failed on average 3.3 antidepressant medications in their current episode. In order to evaluate our success, each patient treated with TMS therapy was evaluated prior to treatment, and their depression and anxiety scores were recorded. We then evaluated patient at different intervals during TMS therapy treatment. We did this at week 2, week 4, and week 6. Then we evaluated some patients for long-term follow-up from months 7 through 11. We used well-known and accepted evaluation surveys to record this information, these being the Beck Depression Inventory Scale, Patient Health Questionnaire, Inventory of Depression Symptomatology, and the Beck Anxiety Scale. Here are our results. This chart shows each of the depression survey's progress before and after treatment. As you can see, the average post score for this patient group showed significant changes in depression symptoms. The majority of our patients got better. To further review our results for reducing depression symptoms, the pie chart on the left shows that 73% of patients had a positive response to treatment. A positive response is when we see a 50% improvement in their depression symptoms. The chart on the right shows the remission of symptoms. As we can see, 69% of patients treated with TMS therapy at the TMS Serenity Center had remission of depression, or another way of saying this, complete relief from depression. These charts were derived from Beck Depression Inventory Scale, one of the highest regarded tools for measuring progress for clinicians. We also looked at the results of TMS therapy in regards to anxiety symptoms. Anxiety symptoms showed a similar result compared to depression symptoms. The chart on the left shows that 70% of individuals had a positive response to TMS therapy. The chart on the right shows that 68% of patients had remission or complete relief of their anxiety symptoms. This is not surprising in that we know that often depression and anxiety coexist. As previously mentioned, we also took a look at the long-term data. This data varied in that not all patients participated in this part of the study. This is not unusual in that many patients who have gotten better move on in life. This chart simply shows that between half and 3/4 of patients who had remission of symptoms after treatment remained in remission, or another way of saying complete relief from depression, 7 to 11 months later. So let's look at the overall results summary. I'd like you to keep in mind that the patients that we treated are considered treatment resistant and have failed on average over 3 medications. These are not just medications that were tried, but medications that were tried at a full dose and for at least a 4-week period. Many of these patients have a history of other depression episodes, which includes many other antidepressant trials. Who can benefit from TMS therapy? In our experience, there are 3 major groups that can benefit. The first are those individuals that are not receiving full benefit from antidepressant medications. We know that roughly 1 out of every 3 people that are being treated for depression are experiencing inadequate results. The second group that can benefit are those that may be receiving relief of symptoms, but antidepressant medication side effects of the medication are limiting their quality of life. Fortunately, TMS therapy has minimal side effects and none of those associated with antidepressant medication, such as weight gain, sexual side effects, upset stomach. The last group who can benefit from TMS therapy are those who have strong thoughts about taking medications. Some individuals may consider themselves naturalists, whereby they do not want to take any antidepressant medications. Others who have medication concerns are those with chronic illnesses that are taking medications that may interact with some other medications. These individuals may include those with depression that are also suffering from diabetes, cardiac, or cancer ailments, for example. The last group with concerns of more medications are women who are suffering from depression during or after pregnancy. It is common for some women to prefer limiting their baby's exposure to medications. Before we share a patient story with you, we hope that this information on the clinical success we are having with TMS has been helpful. We have helped many who have struggled with depression for years to find new hope. We would welcome your call so that we can provide more information for you or for someone you care about. Our phone number is 281-240-4322, or you can email us at TMS Serenity Center at kimcress.com.
Several months ago, my husband was watching the news, and I was in another room doing something, and he came to get me. He had stopped the television, and he wanted to back it up to show me about this thing they were talking about, transcranial magnetic stimulation. And it was Dr. Cress on the news talking about this new treatment for depression. And he immediately said, get in touch with these people, at least go and talk to them. So that night, I got on the computer and I researched TMS, and I found out a lot of good things about it, especially at the Mayo Clinic, and I did a lot of research. And then I sent an email to the Serenity Center. And the next morning, Roxanne called me. And we set up an appointment for the next week. I came in and talked with Dr. Cress, for way more than an hour and a half. And she just helped me help her understand what I'd gone through over the last 20 years and the medications I'd been on and how I reacted to those. And we decided that I was a candidate for TMS. So the next week I started, I think it was the next day, I started the treatments, and I was pretty tense about it. But Roxanne was so great. She just worked with me. At first, the treatment was a little uncomfortable, but she'd say, oh, no, we can fix that. And she would manipulate the machine so that really there's no pain. I have a sensation of like a rubber woodpecker knocking on my head, but it's not painful. And the biggest thing about the TMS was the commitment it was going to take from me. I live quite a ways away, and it was, with light traffic, a 2.5-hour round trip. Now, for someone that could not even get to the grocery store until they were absolutely out of everything, I had to really think about whether or not I was going to be able to do that. But I just kept getting in the car and coming, and I listened to audiobooks on the radio. And after about my 6th or 7th treatment, it wasn't so hard anymore to get in the car and come here. And I started feeling something that I hadn't felt in so long, and I realized I was feeling hope, that there was an end. There was a way to get past this depression. Even just the hope of having hope was enough to get me into the car and get here. My husband first noticed before 2 weeks was up that I seemed a lot calmer. And like I said, I've always been very anxious. And he was right. I felt a calmness inside of me that I hadn't had in so long that it felt kind of weird, you know. But, and just, he said that had started to respond to him more appropriately as far as conversation. I was enjoying talking to my neighbor more. I was getting out and getting my gardens in shape, getting my house clean. And I have a parrot who really takes his cue from me on how he behaves. And within a couple of weeks, he was laughing and singing and swinging, and just he was a changed person too, a changed bird too. I think TMS been a godsend for me. Um, I can't express what it has done for my life, and for the hope I have of spending a good life instead of just existing, instead of wondering if this is all there is, do I even want to go through with the rest of my life? Now I get up in the morning and I'm planning what I'm going to do that day.